Welcome back to the podcast series. In this today's edition, we welcome back Dr. Mendes from the Burns Unit at the Red Cross War Memorial Children's Hospital. And today we are talking burns and burns awareness as we lead into Burns Awareness Week starting shortly. So Dr. Mendes, welcome back and thank you for your time.
Thanks for having me back.
Wonderful. So when we look at the context of Burns Awareness Week, people are going to be talking about all those different kinds of burns that we spoke about previously. What are some of the cases that you are currently seeing in the Burns Unit?
Yeah, so I think as we discussed on the last time, the most common burns we see in pediatrics are generally related to hot water. So hot water burns either from cooking, from boiling kettle, or from bathing, and that forms about 90 or close to 90% of the burns we see throughout the year, sort of 80 to 90. And then flame burns, which people normally associate more with burns, actually only form about 10 to 20% of the pediatric burns that we see. So if you were to look at our ward at the moment, most of it is comprised of hot water burns, or what we call scalds or hot water burns. And we have quite a few large cases in the ward where they over about 20% of the body area has been burned from hot water. And sort of that's what we manage most of the time. And heading into Burns Awareness Week next week, and with the aim of looking at how to prevent injuries, that would be one of the largest areas that we essentially have to focus at or look at the house. Sort of how do you prevent these hot liquid or hot water burns from happening in the household, and sort of what can be done to improve that.
So when you look at maybe one of the cases, a boy or a girl that is currently in the ward, can you walk us through a story with a pseudonym?
So obviously I can't give exact details, but just sort of the type of typical story you would see is, imagine you have a little boy, let's call him T, and he's in the house, he's 3 years old, he's starting to move around the house, grab at things, pull things. He's living in a small establishment or informal housing where they don't have pipes and water and a geyser in the house, so everything gets carried around the house when it's bath time. And they're busy getting ready for the bath, and the parents have poured some hot water or boiled some hot water on a stove or on an open fire, put that in a bucket, and they're getting ready to mix that with cold water for the bath. Now T's curious, he's walking around and he puts his hand on the bucket of hot water and it tips over onto him. And that's now immediately boiling water that's now tipped onto him, sort of from his hand onto his arm. He falls into it, it burns or makes contact with a lot of the chest. And that's sort of a typical story we see where sort of preparing for the bath, and there's a pot of hot water, or cooking and there's a pot of hot water, and a child that's mobile and curious now puts their hand on it and tips it over onto themselves. Now, with a lot of the patients we see do come from informal housing environments where, again, you don't have pipe water. So now our first aid strategies are to get some cooling on the wound. So to either pour water on the wound that's cold
water,
or to apply some sort of dressing which keeps it cold. But that takes some time. Now they have to, in a panic, take the child outside, try cool the wounds under the tap. And then get them to the closest facility, depending on how far away that is. And that's, again, the typical scenario we see, where there's a burn, and there's also a bit of a delay before first aid can be administered, and that often gets done for the first time at the closest health facility. And what we see in the ward is patients like T. He's now had a delay in the first aid care, and the depth of the burn gradually sort of obviously gets worse the longer you wait, and the sort of size of the burn. And that by the time he comes to us, it's now an established burn. I think what's concerning about these sort of burns where you tip hot water over someone is you can cover quite a large portion of the area very quickly. And the time for it to actually become a burn in a child with a thinner skin is within seconds of exposure. So it's not that they have to submerge the hand, but just that splash injury can lead to significant injury. And then when they come to us, we know that hot water burns, in general, we give 3 weeks to heal. So it's going to be a long healing process. And the bigger the burn, the longer it takes to sort of get out of this sort of healing phase of the burn and back out there. And the larger the burn, the more complicated the reconstruction or the grafting options become. So the typical process for him would be then we admit him and we put him on dressings, and then we watch the wound over a few days. If there's areas that look clearly full thickness or concerning, we'll book for an earlier operation. But generally we wait 2 weeks, manage with the dressings, manage with his pain control, and then towards the 2-week mark we start deciding who's going to need an operation or not. So there's a few patients in the ward at the moment, and in this example, if he were to need an operation, it would be a skin graft, where he goes to theatre and you take skin from another section of the body that is unburned, and then you move that over, and that's now another week. Also that patient will probably be in hospital with the theatre, with a wound check afterwards, and all to try sort of get him healed and out of the hospital and back into the community as quickly as you can. I think one of the things we're trying to do more and more is, while the patients are in the ward, they're here for 2 to 3 weeks, is also using that opportunity to educate the parents. And sort of you hope that the parents of a child who's had an injury becomes a bit of a health promotion messenger when they go back home and say, look, this happened to my child, but this was preventable in the following ways. At the hospital or at ChildSafe, they explained to us that, you can prevent these sort of burns by taking certain steps. And I think we aim to do that more and more. Obviously, parents are quite traumatized, so they're not always as receptive, and you don't want to be accusatory and say, why did you do this? You should have done this and this. It's more about changing the message and showing them how to prevent it from happening. Not just to their own child, but spreading the message in the community, sort of how to prevent these sort of burns from happening. I think that's, like I mentioned, one of the common things we see. And the second scenario would be also very similar with hot water, and it's related to kettles and the cord that runs from the kettle. So most kettles will generally be on some countertop or on a surface, but not always plugged in at a high level. So there's often a cord dangling or an extension cord running onto the counter with all the appliances. And similar scenario in a busy household, the child's sort of clambering around playing, and they grab that cord, they pull the cable down, and the cable comes together with the kettle of hot water that's just finished boiling, and that falls onto the child. And that's just in the hot water burns. Probably the two biggest things we see is either open pots or buckets of recently boiled water, or the kettles being pulled over onto the children probably make up the majority of the hot water burns that we see. And then if you had to look at the fire burns or flame burns, there's a child that we recently treated that, he's a 6-year-old. He was at home and he was just a bit curious. There were some matches. He was lighting it and seeing what would happen, lighting a candle. He's seen his parents do it often, but he was very close to the candle when it did light, and that then caught onto his shirt. And unfortunately, a lot of the clothing that is available for children, especially the more affordable clothing, is actually quite flammable.
Right.
Sort of if it's
nylon.
Yeah, nylon or polyester based, as opposed to the more cotton and fire retardant materials. And there are countries in the world where children's clothing has to be out of a fire retardant material, but that's not strictly the case in our country. And a lot of the cheaper clothing is unfortunately quite flammable.
Yeah.
And and then his shirt caught on fire, and again that immediately covers the entire chest area, a section of the arms, a portion of his face that was burnt as well, and a portion of the back. And that happens within seconds. It's an innocent mistake. It can happen in any household, no matter if it's low income, high income. Children get curious, and children playing with fire or the matches, it does lead to a few of the other injuries that we see.
What do doctors do when, some of those materials are close to plastic, so they melt?
Yeah.
And I would imagine some of those burns get quite difficult to manage, because what do you do with the residual?
Yeah, so as part of burns first aid or in a hospital setting, one of the most important first things we do for a burn is cooling it down and then cleaning it. So preferentially with some sort of sedation or, depending on the facility you're in, what degree of sedation you get. Either it could happen in a theatre or in the front room emergency centre with monitoring.
So in essence, that melted plastic must be taken out.
Yeah, so it has to be cleaned quite early, and all burn wounds we see have to be properly cleaned in the first visit, and that's to allow us to assess the burn in its entirety and also to decontaminate the wound. So if there is burned clothing or debris or soot or sort of anything on the wound, it has to be washed off in the first few days, because otherwise you can't assess the wound properly, and you also can't manage the wound while there's something on it like that. So it is quite a painful experience, and as far as possible, it should be done with the child asleep or or at least under very good pain medication.
Right.
But yeah, it has to be done in that first visit. And it's watching all of this is obviously very traumatic to the parents as well.
Yeah.
And if the child, especially if they're a bit older and aware of what's happening, it's also very, very
traumatic for
them to go through this whole experience.
Prevention.
So, I think I mentioned last time, burns is a very emotive topic. And there's no way around the fact that it is a painful thing, and it's a traumatic thing physically and mentally to the patient and to the extended family that was around there, that saw it or feels guilty for having allowed it to happen. And the message of prevention just has to be emphasized, as just like you mentioned now. And the strategies for prevention we touched on last time, it has to be customized to the setting in which you live a bit, because an ideal health promotion program might work well in one setting and not in another setting. And you need to have these messages going out that apply to everyone or are adapted to everyone. And that's where it gets tricky, because people live in very different settings. I think the most important and simplest health prevention things for hot water burns, at least, is, if you look at any circumstance where hot water might be tipped over onto a child, and what can you do in your house to make that a little bit safer? So if you
don't leave the child unsupervised.
Yeah, the first thing is trying to create supervision and an environment where the child isn't exposed to the risks.
Yeah.
Sort of, if you have a bucket of hot water that you're planning on bathing, keep it as high as you can out of reach of the child or in a place that won't tip over, as opposed to leaving it on the floor and walking away to fetch something else, and then the child gets exposed to that. I think the kettles is a sort of, in a way, easy preventative strategy, which is just to not leave cords hanging off the counter. Whether it's a kettle, whether it's a toaster, whether it's anything, if there's something dangling over the counter, a child has a chance of pulling on it, and either way it can lead to an injury. So as far as possible, try run any cords, especially if they're connected to anything that's potentially dangerous, well away from the reach of a child. Make the household a bit safer in that sense. And then just general awareness. I think speaking to the children about the risks, especially when it comes to flame and fire and matches, and that they shouldn't ever do that alone or unsupervised. And so coming back to the hot water ones, the other one I obviously forgot is with the bathing. If you do have sort of a set bath with a geyser, to generally run the cold water first, and then add in the hot water as needed to get the water to the right temperature. What that prevents is you from having a bath full of hot water. Child doesn't realize it's not cold yet, and they just step into it, and then they slip into the bath or whatever happens. Rather have that first water that you run in a bath be cold, and then add the hot water to get the temperature right. Trying to think which other. I know ChildSafe's also promoted the safe candle approach.
Yes.
Where you don't leave a candle exposed on a table where it can be knocked over or blown over in the wind. And always try have the candle in some sort of holder that's a bit more resilient. And the easy strategy here is, and cheapest, is a glass jar, any food jar that you've sort of recovered or rather than throwing it away, you'd use that, fill at the bottom with a bit of sand and put the candle inside that, so it's more of a contained flame. So even if it tips over, it's not going to tip directly onto something that might cause a house fire or a bigger fire. I think that's, there's a lot of these little strategies, and I know there's leaflets or posters from ChildSafe which have lists and lists of things you can do in the house. And it's just more about understanding the risks of a burn and how easily it can happen. It's not something that you have time to prevent, that you can see something about to happen and intervene in time. Often by the time you see something's about to happen, it's already happening. So you have to prevent. You can't have a reactive strategy to prevent burns. And then I think just understanding that the implications of a burn are so major that it really is worth preventing it and not waiting for it to happen and then treating it. It could go on for a while on that.
Thank you very much, Dr. Mendes, for sharing the insights. So there you have it. During this Burn Awareness Week, speak to your children about the dangers of burning. Talk to them about candles, matches, bath water, and how to avert these injuries from happening. If you've enjoyed the content of this video and would like to see more of it, please like, share, subscribe, and follow so that others in your network may also benefit from the insights you've gained here today. Until next time, be burn aware.